Dr. Andrew Rosen. I'm a psychologist.
And I'm Dr. David Gross. I'm a psychiatrist, and we're two shrinks and a mic, and we are back. Today we decided, based upon all the years of experience that we've had together, to talk about the challenges and difficulties facing anybody who decides they're having an emotional mental health problem. Problems like, who do I see first? What kind of mental health specialists do I see? And what are all the different flavors and varieties out there? So we thought we would spend some time doing that. And we know that from many of the patients we've seen over the years, that's a major challenge. I mean, they'll come in and to me at least and say that, I'm getting nowhere in my psychotherapy. And then I ask specifically, well, what kind of therapy are they doing? Or the individual doing? And they'll proceed to say, well, we just talk about what the week was like. And meanwhile, this individual is having panic attacks and is phobic and fearful of lots of things. And so we thought that would be a really good topic to begin to talk about today.
Yeah, I think there's, first of all, in the mental health field, there's different disciplines. There's psychiatry, psychology, social work, mental health counsel, marriage and family therapist. And these days, there's also other kind of non-licensed people, coaches, and all kinds of other people who are giving advice or giving help. So it's very, very difficult for the average person to know, I have a problem, but B, who do I go to? And then what kind of treatment should I pursue? I'm reminded, we were just talking, and I have to add this in. I was reminded of an old Rodney Dangerfield routine where he said he finally went to a psychiatrist, and the psychiatrist told him he was so ugly he should lay face down on the couch. So you never know what you're going to run into out there. But when it comes to how to figure out what kind of a doctor or what kind of a therapist I should go to and what kind of treatment, the first step is trying to identify for yourself, what do I feel like my problem is? Does it feel like I'm anxious? Does it feel like life situations are bothering me? Or does it feel like, no, my life situations are okay, but I just don't feel well a lot of the times? Have you spoken with your primary care doctor about any of these issues? It's complex, but there is good help out there, and there are good treatments.
And if you look at each one of those disciplines, whether it be psychiatry, psychology, mental health counselors, marriage and family therapists, social workers, within each discipline, there's a whole spectrum of capabilities and interests. And so it really is helpful to get a very good evaluation so that at the end of the evaluation, you can hear specifically from the mental health professional you're seeing what they think the problem is and what kind of treatment direction to go in, because the problem needs to be clarified. And as we've talked before, in other fields of medicine, you can get x-rays, blood tests, you can listen to somebody's lung and hear crackles and wheezing and all sorts of difficulties, and that makes it objective. But in our field, we're all dependent upon subjective symptomatology, what somebody reports and tells me. And that's why the language and words that are used are absolutely critical. I tell people ahead of time, if they're going to be seeing a mental health professional, for example, for therapy, to sit down ahead of time and write down on a piece of paper what you're experiencing and be as specific as possible, and include everything. It's easier to, after the fact, to ignore some things and pay attention to other issues, but provide as much information as you can.
I think the first step is to realize, even if you're feeling bad, even if you're not sure what's wrong with you or why you're feeling what you're feeling, you are the person who's really closest to the situation. You know yourself, most likely know yourself better than some stranger or even a friend. So the first step is trying to figure out, what do I feel? When am I feeling it? What symptoms do I have? Do I have any idea what might be causing it? So that's a really important first step. If you can identify what that might be, the second step would be to realize that in the year 2025, there are many, many really very fine institutions or organizations that help you find the right provider. So, for instance, if you have anxiety, the Anxiety Disorders Association and Depression Association of America, they have a list of providers in all different parts of the country that have basically been credentialed by the organization. That you have to have a certain degree of credentialing to be a member. So by doing that, you're kind of reassuring yourself that you're going to find somebody who knows what they're doing and has some quality training. Unfortunately, if any of us look up websites or go online and we look up Dr. X, many Dr. X's say they specialize and then they specialize in 100 things. So, in general, I encourage people to avoid somebody who specializes in everything and find somebody who specializes in the problem that you think you might have, and then go to that person and get an assessment. It might be the right place, it may not be, but at least that's the first step.
You know, the Dr. Google concept becomes a problem. It's a bit better now that artificial intelligence is part of most search engines because they give you a reasonable summary when you ask a question. But it's easy to get lost in the rabbit hole of various sites. And so I tell people to get on verified sites that could be helpful. You mentioned the Anxiety and Mood Disorder Association of America, which is a very good one to get educated because it's a clearinghouse of information. I tell people to get on the American Psychological Association website, the American Psychiatric Association website. National Institute of Mental Health is another very good website. National Institute of Drug Abuse for substance abuse problems is a clearinghouse with loads and loads of information, at least to educate yourself about the nature of the symptoms. But when it comes to deciding what kind of help or if you need help, I tell individuals to do an inventory as to how you have changed from your normal baseline life. What are you not doing that you used to do? What are you not enjoying that you used to do? What are people around you telling you that's changed? Telling you that gee, you're quieter, that you're not enjoying things as much, you're not smiling, or they're telling you that you seem internally preoccupied and distracted, or that you're shaky and anxious. But gather as much information as you can and be as specific as you can, describing how I am different now than I was a month ago, or 6 months ago, or even a year ago. Because sadly, there are a lot of people who suffer with emotional and mental health difficulties for months and months and months before getting help.
I spoke with somebody a few weeks ago who um, was feeling depressed and drinking too much, and I asked some questions about that and asked if there was any long history of this or was it more of a recent history. And with some thought, because the person really kind of maybe forgot about this or negated its importance, said, "Well, I lost both my parents right in the beginning of COVID, and she had never gotten over it." So in her case, it was a grief reaction that started the cascading of depression and anxiety and substances. So maybe the person would take this inventory like you're talking about and would realize, well, wait a minute, all this started when such and such happened to me. And that might guide where you're going to in terms of the appropriate clinician. It may be that you need to see somebody who actually specializes in grief. There are people who do that.
You know, you raised a very good point about how substances can be a red flag. I'll see a lot of people who, because of the difficulties that alcohol, marijuana, or other substances have created, end up going into a treatment loop involved with substance. Whereas, in fact, as you're suggesting, they were self-medicating an underlying problem, and you can get lost in the realm of getting substance abuse treatment and not pay attention to the core problem. It is true, however, that if somebody has, for example, a significant alcohol problem and they're numbing themselves with alcohol, they can successfully begin adequate mental health treatment until the alcohol is no longer affecting the brain because of how it has a negative effect upon brain function. But it's really a matter of prioritizing the problems and recognizing that, well, if we need to attend to the alcohol problem first, let's do that, but let's not ignore either the psychological issues related to the personality problems they have, or the grief reaction as you describe, or the underlying social anxiety disorder that they've had all their lives that they've used alcohol to self-medicate.
So, needless to say, it sometimes it's a very simple question to answer, like what's going on and what might have caused it. Sometimes it's pretty obvious, but most of the time it's a little more complex than that. Human beings are complex, so we've talked about it many times about that. Our hypothesis is, our belief is that each one of us is a combination of biology, psychology, and social, and it's very important to look at those three parts of us in determining what is going on, what is my problem, what do I need to address first. So, as you like you just said, if it's a problem of substance use or abuse, well, we better deal with that biology part first, because if we don't help that get under control, it's going to be very hard to deal with the psychological and the social part of it. So that requires you seeing somebody who knows how to do what we call a good comprehensive differential diagnosis, trying to pick it apart so we know where to go first. Very similar to if you went to the emergency room, they have to figure out if you have an injury or if you're sick, what do we need to look at first? Do we treat the ingrown toenail or do we stop the bleeding? And it's kind of like that.
That reminds me of the benefits of cases that we've shared together, in that I may do a better job taking a look at the biological, brain, neurological aspects of a case. But then as we discuss cases, you'll fill in the blanks of the psychological family dynamics, family situations that I may not have seen as openly. And it's that kind of interaction that is most important. Um, Unfortunately, if an individual comes to see a non-MD, sometimes what will be focused on is what's called the psychosocial evaluation. That's what's the psychology and what's the life situation like and where do they come from, and not really have the ability to take a look at the biological or brain aspects of it. Um, One of the advantages that we've had, because within a multimodality, multidisciplinary outpatient system, is that we've got other clinicians around us where we can share cases and discuss cases, and humility and being humble in our field is absolutely critical, because we don't know everything, and it's always helpful to ask for help and reach out and discuss a case with somebody else and say, what am I missing here? What else do you think is going on besides what I've described to you?
If you are looking for somebody, it's probably a really good idea to look for somebody who's in, as you just said, a multidisciplinary practice, because that means that that person has a mindset that is not very hyper focused on one of these variables. They're part of a team, so they think that way. They think globally. They think about the biopsychosocial possibilities. So if you do have a problem that is primarily medical, if you go to somebody who's part of a team, you're probably going to also have to take a good look at the other aspects and not just get pigeonholed into one particular realm of the problem. So that's just from my perspective, especially in the last number of years. The best thing you can do if you're looking for help, look for somebody who's part of a multidisciplinary practice or works very closely with another mental health professional, so that there's this synchronicity in terms of thinking and even checking with somebody else to get another opinion about how this thing is working.
I've over the years, I've spent a lot of time trying to provide mentoring to either young psychiatrists or psychiatric residents, individuals who are still in their residency training program, to talk about what is life after residency like, or what is life like in early stage of practice. And I tell people, if you hang up a shingle and do independent practice, um, you can learn from your patients, but there's only a finite amount that you can continue to learn. None of us, when we come out of training, know everything. It took me at least 5 years to feel like I had a better grasp of the field that I had spent years in training, learning about, both book learning and practical training. But even after that, there's a lot still to be learned. But when you're doing solo practice, the learning doesn't really continue. And what I see happening to a lot of people is that they grab onto the model that they learned earlier on, and they become too rigid in staying with that model. For example, if somebody comes in and they says they're depressed, immediately hand out an antidepressant instead of looking more in detail to what this depression is all about, whether or not it could be psychologically based, situationally based, or even related to a medical problem like a sluggish thyroid. So, most of the times I advise young psychiatrists to look into a practice model where they'll be around other people and can learn and be mentored by more experienced clinicians. In other areas of medicine, that's not a problem. So, for example, if you're an internist, you do stay in your office, but you'll also end up going to the hospital, making rounds, seeing colleagues, talking about cases together, going to lunch with other colleagues, going to the medical morbidity and mortality conferences. And so there the learning continues. But in mental health, it can be very isolating and limiting in terms of future growth.
So if you're the patient or the prospective patient and you have a really good idea about what is bothering you or what your problem is, you want to go to see somebody who specializes in that. For instance, if you're having problem with a phobia, pretty simple. If you're not having any other issues and you're just kind of isolated to, yes, I'm terrified of being on an airplane. Well, or I'm terrified of, I moved into New York City and I'm terrified of elevators. Well, those are kind of simple phobias that we can treat in a very specific way and not necessarily deal with any other variables that the person might have going on in their life. If you know, for instance, that everything you have read about and learned about, I think I have obsessive compulsive disorder, well, then you want to go see a person or a part of a group that specializes in the treatment of obsessive compulsive disorder. Those are cases or types of diagnoses where, we've really, really gotten pretty good at diagnosing and coming up with really good, effective treatment plans, whether they be primarily medical or primarily what we call cognitive behavioral or a mixture of the two. But there's many patients who just feel bad. They don't know why they feel bad. They've all of a sudden or over a period of time, they realize, as you were saying before, that I'm not enjoying life. I don't feel any drive. I don't feel like it matters anymore. And I just feel low. I don't care to do anything. And I don't know where this came from. Then that's a more complex issue and will require more complex assessment and probably a more complex treatment. Not necessarily, but probably. So it's important to just decide, do you know what your issue is? Do you know what your problem is? If so, move along in that direction. And like we were talking about the different organizations that you can go to that will guide you into finding a good clinician in your area. But if it's more complicated, well, sometimes if you have a good family physician or primary care doc, that could be the place to start and say, look, I'm just not feeling well. And they do a medical eval and they go, well, it seems like physically you're doing okay, but let's pursue this more. And sometimes that primary care doc can refer you to the appropriate group or clinician that will then do that assessment.
The other challenge that individuals have because healthcare is now dominated by insurance companies. For the good or for the bad, managed care is what's been going on now for decades. Sometimes it's better described as mangled care, but nevertheless, it's the reality that we have to deal with. So an individual who wants to go through their insurance company because of finances, which is certainly understandable, will call up their insurance company and say, I'm depressed, need to see somebody. Well, the reality is that because the insurance companies are in the business to make money, many of their mental health providers on their provider list will be master's level clinicians because they get paid less by the insurance companies. And not to minimize the value of seeing a master's level clinician, but you may not get the full evaluation that you need. So if you have, for example, as you described before, a fear of flying and need to get specific treatment, that's where Dr. Google can become helpful because you can type into Dr. Google best treatment for fear of flying, and you'll get a reply with the help of artificial intelligence that will say you need to have cognitive behavioral therapy. And so then you can, when you call the insurance company, you can ask specifically for a clinician that has expertise in cognitive behavioral therapy. Um, you then have to go another step because we will tend to put on our forms that we fill out for the insurance companies lots of things that we think we can do, and you could take a course on the weekend in cognitive behavioral therapy and suddenly become a card carrying cognitive behavioral therapist, which is opposed to somebody who spent a year or two studying it. So it then pays once you meet with that clinician to find out, what their background and training is in cognitive behavioral therapy and what kind of approach do they use for fear of flying, for example. If they begin to talk about exposure therapy and the like, then you're going on the right track. So that is a big piece of it, and it's the reality that we're all dealing with because not everybody can afford to see somebody in the mental health field when the insurance does not play a role. So be very specific, do your homework, get the information that you need, and then make sure the mental health clinician who's been assigned to you by the insurance company is the real thing.
And there is an unfortunate artifact that dealing with managed care and insurance companies, and that is there's a tendency, it's not always the case, so I don't mean to make people too upset, but there's a tendency for the more well trained and certified clinicians who have spent those extra couple of years learning a particular disorder and treatment to not be accepting insurance because insurance pays typically so little. So there's a kind of a distillation process that goes on. So if you're going to use insurance, it's really essential that you do that kind of screening to see, does that clinician who's accepting insurance really have the degree of experience and training that you require as an individual? Because you're using insurance doesn't mean that your needs, your clinical needs, are any less. They're just as important.
It is what I call the post-COVID telehealth syndrome. Um, if you get on a dating app and you meet somebody online who you're interested in, at some point you might have a phone call with that individual, but at some point you're going to want to get together over a cup of coffee or a meal in person. And so you've all seen the commercials on television for all the teletherapy sites that will get you a therapist that you'll never see in three dimensions. And so seeing that individual in person, at least for the first meeting, I think is very important because there's a lot to be said for sitting down with somebody and getting a sense of who they are. I tell people all the time how good a listener was that individual, whether it be a psychologist, psychiatrist, or a mental health counselor. Were they a good listener? Were they really listening to you, or did they make up their mind within the first 5 minutes of the consultation? Uh, was there eye contact made, or did they seem to be distracted by something else? And unfortunately, in this day and age, with the role of computers, electronic health records, many clinicians will be sitting in front of a screen, supposedly while they're listening to you, while they're typing away, putting the information into their electronic health records. So getting a sense of whether or not that individual's really tuned into what you're saying, and then does that mental health professional ask you the right questions? Things like, tell me what it's like to be anxious about flying. What happens to you when you even think about going to the airport? What happens if you're able to get to the airport? What happens if you get on the plane? Have you had to get off the plane before it took off because of anxiety? All those questions. So that gives you a sense that the individual knows what you're going through. I've heard from individuals I've worked with over the years that they tell me that I've asked them the kind of questions that give them a sense that I know what they're going through. I may not have experienced it myself, but I've heard it so many other times that I know what kind of questions to ask to get the data that I need to get a better understanding as to what's wrong with them.
When a person is really hurting and scared and really doing poorly, they're desperate. They just want help. And I use this as an analogy. If you haven't eaten all day, you're really starving and your stomach is growling and you're just feeling like, oh my God, I need to eat something. And You'll look in the refrigerator and there's not much there, but there might be something that's a few days old, but you are so hungry you convince yourself it's adequate. It'll do the job. And then you hope you're not going to get sick from it. Well, I think it's similar. If you're really hungry for help and desperate, try to do the research that we're talking about first. And if you're having a hard time, ask somebody who you trust, a friend, a family member, a spouse, anybody, or a doctor. Help me find the best person. Very often, I get phone calls from people that they're not calling me to treat them. They're calling me because they know me, or they've heard of me, or their friends told them to call me, and I'll direct them in the right direction, because it's nothing worse than finally going to get help, and then you find out that the place you've gone is not helping you, and sometimes even making you worse. So do the research. It's very important.
In no way do we mean to throw cold water on the whole field of mental health, but there are these realities that we've talked about today, and we hope to continue this discussion in part two of this problem. And so we'll sign off for now. I'm Dr. David Gross, psychiatrist.
And I'm Dr. Andrew Rosen, psychologist.
And we're two shrinks and a mic.
See ya. The Two Shrinks and a Mic podcast is for informational and entertainment purposes only. The views expressed are those of the hosts and guests and do not constitute medical, legal, or professional advice.
Please always consult a qualified healthcare provider before making any medical or wellness decisions. Our content is not a substitute for professional medical guidance, even though our mothers tell us we have the best advice possible.